All right. Good afternoon and good morning, everyone. Welcome to NCI SBIR webinar about NCI's R&D Research and Development contracts for fiscal year 2022. My name is Reema Railkar. I am Program Manager at NCI SBIR Development Center. I'm one of the speakers today. Along with me, we have Michael Weingarten, who is a director of NCI SBIR Development Center, and we have Christine Biser, who is a contracting officer at Office of Acquisitions, NCI's Office of Acquisitions, or OA. Bit of housekeeping before we go ahead. The slides from today's talk will be provided to all the registered attendees after the webinar. You will be muted during the webinar. If you have any questions, please submit them via the Q&A box that you would see at the right bottom of your screen. And of course, once you receive the slides, we would love to hear your feedback using the link provided here. Between the three of us, we will talk about the background about the SBIR STTR program, about our NCI SBIR Development Center. We'll talk about some of the contracts overview, contract topics, and finally, a very important topic, which is how to write a budget in using Appendix C. And we will end the session with Q&A section. With that, I will hand over the podium to Michael, and I'll stop here. Michael?
Thanks so much, Reema. I appreciate it. Want to welcome everybody to the webinar today. This is a big moment for us because we're going to be releasing 16 new funding opportunities today. And Reema is going to run through the details on each of those specific contract opportunities. And then Sherry's going to be able to answer questions related to the whole contracts process. So I thought I would just give you a couple minutes to give you an overview of the SBIR program at the National Cancer Institute so you can understand how this contract solicitation kind of fits into the broader program as a whole. Next slide, please. So just a little bit of background about the SBIR program. It's what's known, or what we think of as, America's seed fund. It's actually the largest fund for startup companies across the country. And the NIH is the second largest program across the government, Department of Defense being the largest. So I'm going to focus on the program that we have at the NCI and at the NIH. Next slide, please. So SBIR is what we call a government set-aside program. And what that means is that Congress actually sets aside a certain percentage of the NCI and the NIH budget that's required to go to both the Small Business Innovation Research Program, the larger program, and the Small Business Technology Transfer Program, STTR. And as you can see, our budget for this current year is actually going to be right around $180 million. But across the NIH as a whole, it's close to $1.2 billion. So it's a very large program, and it's really our major vehicle for supporting the development and commercialization of promising technologies for the detection and treatment of cancers. Next slide, please. So one of the things that makes the NCI unique is we obviously offer funding through the program, but we've done a number of other things to really support the needs of small businesses. And probably the most important thing that we did, and when we built this program a little over 10 years ago, is we created what we call the SBIR Development Center. And this is a center that's staffed with 22 people who spend full time just working with small businesses or soon to be small businesses like yourselves. And these are just some of the different services that we offer through SBIR. We offer funding, as I mentioned, but we also manage all the projects that are funded through the SBIR program and STTR program. It's a portfolio of about 400 projects, typically on an annual basis. But we also weave in a number of additional services specifically aimed at supporting your needs as you advance and move your technology towards commercialization. That includes commercialization assistance, also includes training and mentoring. It involves collecting metrics on the program, engaging in outreach sessions like the one we're doing today, where we can help really educate you and others about the program. And we also put a big focus on diversity and inclusion with our SBIR program. Next slide, please. We also offer, I just wanted to give you some examples of just some of the different assistance programs we offer. First is the Application Assistance Program. This is a program that's actually open to companies that have never received NIH SBIR funding in the past. And essentially, it's a program where NCI will provide a coach to advise and assist you as you're going through the process of developing your application. They can provide tips and advice typically on what the NIH is looking for in terms of a strong proposal. We also offer a program called Innovation Corps, or I-Corps. That's an entrepreneurship training program. Many of our companies who come into the program are startups that spun out of a university, so have strong scientific pedigrees, but really don't have much in the way of business or entrepreneurial backgrounds. I-Corps can help kind of provide a core base of experience that can really help the company build and grow. We also offer a program we call our NCI Investor Initiatives Program. And essentially, over the last 12 years, we've built a very strong network with the investment community, including the venture capital community, as well as large pharmaceutical companies, medical and large medical device companies. And once a year, we offer the opportunity for our companies in our portfolio to apply to participate in this program. And under the program, if you do participate, you'll actually go through a review by our investor panel that we've developed relationships with, and they help us identify some of the most promising companies in our portfolio, and then we will actually fund those companies to go and pitch at private investor events. Just a couple of the other programs that we offer. Once every 2 years, we put on a commercialization workshop. We call this event we call it TREX, and it's actually a 2 to 3 day workshop where we bring in leaders from across the government that you might need to interact with. For example, representatives from the FDA and from CMS to talk about regulatory strategy, reimbursement strategy. But we also bring in other programs, for example, across the government that also offer other funding opportunities that you might be eligible for. So that's just a sampling of just some of the different programs we offer. Next slide, please. SBIR is a 3-phase program. Phase 1 is typically a feasibility study or a proof of concept study. We have different funding limits that we put in place for our SBIR program. For the NCI, that funding limit is up to $400,000 for phase 1. If you're successful during your phase 1, then you have the opportunity to apply for a phase 2 award, which is the continued research and development of the technology. We allow funding up to $2 million over a 2-year time frame for our phase 2 projects. And then if you're successful in both phase 1 and phase 2, you can apply for our next stage of funding. We call it our phase 2B Bridge Award program. Typically, for bridge awards, we're funding projects and those include drugs, devices, and other areas, really technology areas across the cancer spectrum. But we provide up to $4 million to continue developing the technology. And our goal here is to fund the technology to a clear inflection point where private investors would be able to step in and move that technology help provide the funding to move that technology towards commercialization. One expectation of our Bridge Award program, under the NCI will offer up to $4 million in funding, but our expectation is that applicants who do apply for the Bridge Award will also have a fundraising plan to bring in matching funds for the NCI investment. Next slide, please. This gives you a little bit of a look at our overall portfolio. As you can see, it's very broad-based. It really cuts across the cancer spectrum. And these are just some of the different areas that we fund. Drug development being the largest overall category. Typically, it's about 40% of the projects that we fund are drug projects. We also fund projects in the areas of devices and diagnostics. These are also very important parts of our portfolio. And then we fund projects in the areas of research tools and digital health too. Next slide, please. Just a couple of other examples of new funding opportunities that we just launched this past year. These are not currently active, but we will be launching these programs again in the fall. The first program is a program we call the Small Business Transition Grant. And essentially, this is a training, really a training and development grant that we offer to the main candidates or postdocs when they're still at a university, where the postdoc working as part of a team has developed some promising intellectual property, and the postdoc is interested in moving that technology out of the university and towards a small business. This actually provides the funding to both provide the training as well as the mentorship of the postdoc while they're still at the university, and to help them transition from the university to a small business. So as you can see by the slide here, our expectation as part of this award is that you will actually have a mentoring plan as part of the program. You'll have both a technical mentor and a business mentor. That's actually part of, we ask you to identify that as part of the application, and the NCI funding can go to cover some of the costs associated with that. And then we will fund both the phase 1 work and the phase 2 work associated with the development of that technology, in addition to the training component to this. By the time you complete your phase 1 and you advance the technology into the phase 2 part of the project, our expectation is that the postdoc will then move to a small business to continue the work on that technology and to move it to commercialization while they're at the small business. Again, this announcement will come out again and be open for competition in the fall of this year. Next slide, please. And then finally, this is another program that we launched this year. This is called our NCI SBIR Concept Award. This was actually a contract funding opportunity. And the whole goal of the Concept Award is to fund high-risk, high-reward new technology developments in the areas of pediatric and rare cancers. Our goal is to really fund disruptive technology developments out of the box type ideas. The amount of funding available under this program is up to $300,000 in total costs. The expectation is that it's a 1-year award. And again, this program will be launched again in the fall of this year. And on that, I will hand it back to Reema.
Thank you, Michael. So I'm gonna talk about the introduction about a little bit about contracts, as well as all the 16 contract topics that are there for FY 2022. And I would like to remind you all that the slides from today's presentation, today's webinar, would be shared with all the registered attendees. Investor-initiated omnibus solicitations form the biggest chunk of all our grants. However, NCI is also a prolific user of research and development contracts as a mechanism to fund NCI scientific and technology priority areas that also have strong potential for commercial success. I want to remind you, these are not the service contracts, these are research and development contracts. These are all the active grants and contracts that are active right now at NCI SBIR Development Center. For remainder of our talk, we will focus on the contract solicitation PHS 2022-1. So why does NCI fund R&D contracts? So the NIH as well as NCI treat our R&D contracts a little different compared to other federal agencies such as DoD. In that regard, that NIH in most of the cases is not an eventual customer for the product that is developed using these contracts. Hence the reason why NCI or NIH fund these contracts is a little different compared to other agencies. And so, for example, if there are any specific needs of the community that are not taken care of via the omnibus solicitation grants, or there are some specific need to commercialize, in emerging areas, that's where we solicit the contracts. For example, this year we have a specific contract topic regarding the extrachromosomal DNAs in cancer. Another reason is, and we don't have that kind of contract topic this year. However, we have had these before, is to stimulate the technology transfer for the NIH or NCI grown technologies into the commercial space. And finally, there are instances when the contract was solicited to streamline the product development for a really important product such as anti-cancer agent. The next obvious question is, what is the difference between the grant and the contract mechanism? And there are a number of differences. The first one is the scope of proposal. And in case of grants, it is defined by the investigator, whereas in case of contracts, it is focused and it is determined by NIH. When you read each of the contract topics for NCI this year, you will see that there are deliverables for phase 1 and phase 2 clearly written. Unlike the grants, which are peer reviewed at the NIH Center for Scientific Review, the contracts are reviewed within the NCI by the Division of Extramural Activities. They have special review panels to accommodate as many business reviewers as possible. There is only one receipt date for contracts per year, and this year it is October 28th at 5 p.m. EDT. For contracts, you cannot contact the program director at the NCI SBIR. However, if you have any questions, you must contact the contracting officer. NCI SBIR has set aside funds for the contracts. Every year, out of our around $180 million budget, NCI SBIR sets aside about 12 to 20% budget for funding the contracts. And this negotiation process, I'll talk about it after a couple of slides. So the contract, finding the contract every year is not just an NCI SBIR focused activity. It is a trans-NCI process where program directors from different branches and different offices of NCI, including sometimes even NCI Director Dr. Ned Sharpless, submit their ideas. This year we have, for the first time, we have FDA's CDRH, that is Center for Devices and Radiological Health branch, contributed to the 2 contract topics. These ideas go through a rigorous process of review at various levels, such as at program level, at scientific leaders level, at Moonshot Committee, even at the Board of Scientific Advisors for NCI. Here, these ideas are scrutinized for their scientific merit, for the needs of community, for the needs of NCI portfolio, and finally, their potential of commercialization. This led to publication of 16 contract topics for NCI for the fiscal year of FY2022. The solicitation document is here, and please do read it carefully. The individual contract topics you can read here. And if you have any questions about the NCI SBIR contracts, please contact Sherry Wells at NCI SBIR at mail.nih.gov. So this is the bird's eye view of contracts process. We are here at the beginning of the solicitation release. And I mentioned in my previous slide is that the technical review for the contract happens within the NCI. The review criteria, and I think the section 6 of the contract or solicitation document mentions about the review criteria. They are a little bit different compared to the review criteria of a grant. The fast track and the phase 2 contracts are reviewed independently. And finally, I would like to talk about the negotiation phase, which is very important. Here, the prospective offerers get a chance to address the negative comments from the reviewers. And this happens in the technical aspect of the contract negotiation portion, whereas Office of Acquisitions or OA have questions. They ask you questions about the financial and the business aspect of that part. So there is a lot of back and forth that goes on during this period. And once there is a satisfactory conclusion of the negotiations process, the offerers receive the award. So eligibility for the contracts is same as that of the eligibility for omnibus solicitation, which means that the award is always made to a small business concern. The small business concern is basically organized for profit US business with 500 or fewer employees and 50% or more owned by US individuals or entities. So before I go into the actual contract topics, there are a few things to remember. First of all, submit the proposal on time, which is not 5 minutes before the deadline. The good practice is at least submit your electronic proposal at least 1 business day ahead of time. Include all the required documents. Most forgotten ones are your proof of registration with sbir.gov. So don't forget these proof of registration from sbir.gov as well as sam.gov. You will need to have an active System of Award Management or SAM registration for all the awards by the time of proposal submission. And this registration takes several weeks. So start early on this one. Human subject form must be included in the proposal, even if it is just to say that no human subjects will be used. Next one is do not exceed the page limit, and there is no set template for the proposal. However, the section 8 of the contract solicitation document have instructions about how overall proposal should look like. And as I mentioned before, section 6 talks about how the proposal will be reviewed. So bottom line is that please read the contracts solicitation document carefully. Once you have the contract or once the contract is awarded, most important thing to remember is that the payment schedule for the contracts is different than that of the grants. And extension for the contract is permitted and on case-by-case basis. However, it is always better to contact your contracting officer early on. So NCI has 16 contract topics for the fiscal year of 2021. Again, I would urge you to read them carefully to understand the goals and the deliverables of for each contract topic. Here I have provided the link for each topic. The budget for phase 1 of NCI topics is maximum of 400,000 for the period of up to 12 months for phase 1. And this is slightly different from all our previous years when this period was only up to 9 months. So we have, for phase 1, we have the period available up to 12 months. For phase 2, It is maximum of $2 million for up to the period of 2 years. For all the next slides, I'm going to read the name of the contract topic and maybe a little bit about the scope. And but then again, please read the contract topics carefully. You can see that for some of the topics, fast tracks are allowed, and for some of the topics, direct to phase 2s are allowed. And just pay attention to those. So the first one is topic 430, development of xenotherapeutic agents for cancer treatment. Here the goal is to develop antisenescence or xenotherapeutic agents as anti-cancer drugs. The next topic is 431, cancer treatment technologies for low resource settings. The goal of this topic is to support low resource setting appropriate technologies for cancer treatment, and products addressing cancers of cervix, colon, rectum, esophagus, and oral cavity are particularly encouraged for this solicitation. Topic 432, synthetic biology gene circuits for cancer therapy. This topic is a reissue from last year. The goal here is to develop gene circuit therapies for cancer by engineering immune cells or cancer cells or both. Next topic is 433, developing unbiased medical technologies to reduce disparities in cancer outcomes. The goal here is to create scalable health IT-based informatic tools that measure the patient care coordination in order to assess and improve quality of patient care and patient outcomes, to assist the ongoing healthcare delivery system transformation and improve research efficiency. Next is topic 434, ultra-fast dose rate or FLASH, radiation detectors and safety systems. The goal is to advance the development and application of devices to allow FLASH radiation therapy to be properly evaluated and ultimately translated into the clinic. Next topic is topic number 435, devices to treat secondary lymphedema following cancer treatment. The goal is to support the development of technologies that prevent, reduce, or eliminate lymphedema following removal or radiation of lymph nodes due to cancer in the upper body, which means neck, chest, etc. Topic 436, new technologies to analyze extrachromosomal DNA in cancer. The goal of this contract topic is to stimulate the development of new and advanced analytical approaches that can support research into mechanisms giving rise to extrachromosomal DNA formation, organization, and its role in cancer. Topic 437, again a reissue from last year, 3D spatial omics for molecular and cellular tumor atlas construction. The goal is to advance the development and dissemination of imaging workflows that are capable of omics level measurement in thick tissue resections or whole biopsy cores. Another issue from last year, 438, understanding cancer tumor genomic results, technology applications for community providers. Here, the goal is to develop tools and technologies for oncologists for them to understand the NGS results of their patients. Topic 439, advanced sample processing platforms for downstream single cell multiomic analysis. The goal is to development of technologies to improve single cell multiomic pre-analytical microfluidic platform that integrates steps of pre-analytic workflows such as sample processing, single cell separation, etc. Topic 440, cancer prevention and diagnosis technologies for low resource setting. The goal here is to develop, adapt, apply, and validate existing or emerging technologies into low resource setting appropriate technologies for cancer prevention, early detection, or diagnosis of cancer. This particular proposal has a particular focus for cervical cancer, and it is focused on development of rapid HPV diagnostics at the point of need. For example, a portable loop-mediated isothermal amplification or LAMP-based assays. Topic 441 is at-home screening for hepatitis C virus. And the goal here is to develop and validate a rapid sample-to-answer point-of-care test for hepatitis C virus exposure or active infection. This is the first topic that has been developed in collaboration with FDA's CDRH. Topic 442, quantitative biomarkers as medical device development tools or MDDT tools for cancer. The goal of this topic is to stimulate the participation of small businesses in FDA's MDDT program to develop quantitative biomarker tests. The activities include development and optimization of a biomarker-based assay that meets the criteria defined by FDA's MDDT or Medical Device Development Tools program. Next topic is topic 443, development of computer-aided diagnosis tools for upper and lower gastrointestinal tract cancer prevention. The goal here is to advance the development and application of AI-based algorithms that improve visual human-based determination of precancerous lesions examined through visual inspection of upper and lower endoscopies. Another topic developed with in collaboration with FDA, the topic number 444, evaluation data sets as medical device development tool for testing cancer technologies. The goal here is to stimulate the participation of small businesses in FDA's MDDT program to develop and demonstrate the utility of qualified data sets as MDDTs to assess medical device subject to regulation by CDRH. And finally, another issue from last year, topic 445, advanced manufacturing to speed availability of emerging autologous cell-based therapies. The goal is to stimulate the development of advanced manufacturing that substantially improve the speed and cost of producing autologous cell-based therapies. The contract topics that we have developed in collaboration with FDA CDRH, that is the contract topic number 442 and contract topic number 444, are a little bit different compared to our other contract topics. Hence, we have a specific outreach event targeted towards these two topics on August 24th. So if you are interested in applying for either one of these two topics, please do join this outreach event. Do not miss it, because we have program directors from NCI SBIR, we have experts from FDA, and we have experts from and the contracting officers from NCI's Office of Acquisitions. They're going to join this event to answer the questions you may have regarding these two topics. Apart from that, we have a similar, just like today's, another contracts webinar on September 21st. If you have any further questions, and of course, do sign up for our e-newsletter for the latest updates. In his slides, Michael mentioned about some of the number of assistants or resources available for the awardees at NCI SBIR. And I'm going to talk about one of them, which is relevant for you during the proposal writing, and that is ICOR at NIH program. So ICOR at NIH program, and Michael mentioned this before, it is a customer discovery based entrepreneurial training program that helps define value proposition and business development strategies. The curriculum was first developed for NSF, and we at NIH have further tailored it for the needs of life science and biotech industry. The ICOR at NIH program is designed to complement activities within the scope of Phase 1 award. So any offerers submitting Phase 1 for a phase 1 proposal for any of the NCI 2022 contract topics may include a potential participation in the ICONAT NIH program within their phase 1 proposal. They must submit the separate Appendix C, and Christine is going to talk about what Appendix C is and how to fill it up. So they must submit a separate Appendix C contract pricing proposal following the cost guidance that are set forth. Finally, this is my final slide, and please do remember, read the program solicitation document carefully, submit your proposal on time, submit all the required registration proofs. If you have any question, contact the OA at ncioasbir@mail.nih.gov. And when you're writing the proposal, do understand the components of both technical and business proposals and guidelines related to those, like, for example, like budget, for example, fringe and overhead guidelines. And I think our next speaker is going to talk a little more about that. So with that, I will go ahead and give the podium to Christine Biser, who is a contracting officer at NCI Office of Acquisition. Christine.
Hi there, everybody. Thank you for participating in this presentation. I was very happy to be asked to present on the Appendix C. I have the first slide up that shows the Appendix C. We refer to this as the cost proposal, the business proposal, Appendix C, App C, and the first page. I will be speaking mostly about the first page because the other pages are more or less backup to the information on this page. And as a contracting officer, I look at this and I review this to make sure that the numbers on it support a healthy outcome for the contract, especially for the beginning business, the small business. So on the left side of my slide, you'll see a number of the items that I'll be talking about. They are fairly interrelated, and I have put them in an order that I thought was about as logical as could be, but there's a lot of overlap between these. So the first one is what's the difference between overhead and G&A costs? Then estimating all of these indirect costs when you don't have a negotiated indirect cost rate agreement yet. Then there will be determining the basis for indirect costs. And if you look on the Appendix C, you will see that in the middle, the second column, the third column actually there, you will see a grayed out field that says basis, and that is what I'm talking about when I'm talking about it, determining basis. And sometimes there are exclusions that apply. Then there is the 40% IDC rule. The official title for the announcement, you'll see in the parentheses there, the NOTOD 09038. You can Google that and it'll come up and tell you about it. And I will say what it does mean and what it does not mean. And then finally, I'll discuss briefly the ratio of prime to subcontractor costs. So most people can define what an indirect cost rate is. A cost is, it is not a direct cost. Beyond that, it gets a little bit fuzzy. And if you look in the solicitation, you will find that the solicitation does not define overhead and it does not define G&A, and you might wonder why. And the reason why is because it is covered in what we call the Federal Acquisition Regulation. That can also be Googled, Federal Acquisition Regulation. It is a very long set of regulations that apply to contracts. And if you go there, you will find that it also does not define overhead or G&A. It does define indirect costs. If there's a particular part in the FAR 31 that discusses indirect costs, and it basically winnows out between indirect costs for small businesses and what the government calls other than small businesses. And all you'll get from the FAR is a basic suggestion to group your indirect cost rates into logical groupings. There is help, however. The NIH Division of Financial Advisory Services has developed a website and numerous materials that will help a small business like the SBIR contract applicants to fill out and determine their costs. They have on their website, they have a frequently asked questions. If you Google DFAS, DFAS, frequently asked questions, the first one says, what is the difference between a direct cost and an indirect cost? So that is an excellent place to go. And that question also has a particularly succinct way to winnow out the difference between overhead indirect costs and G&A. And I will just read it briefly. It says that overhead indirect costs are associated with the performance of a project. So they define that as facility costs, rent, heat, electricity, general laboratory supplies, and they define G&A as associated with overall management of the organization. So that would include things like the president's office, the human resources office, accounting, office supplies that everybody uses. And that, I think, is a good definition to keep in mind as you navigate through this Appendix C and fill out the figures and the values in it. So if you go to that DFAS website, so the first question might be, why are these things not defined? Why is it so difficult? And the answer is because it depends. It depends a lot on the business owner. It depends on what sort of accounting practices you have adopted for your business. It depends on the size of your business. It depends on the industry you're in. So there's no quick and easy answer to those questions. Now, if you go to the DFAS website, there is a heading, Indirect Costs, Definitions and Examples. And you will find there two things that you can download, two Excel worksheets that you can download. One of them is called a 2-tier workshop. It's in Excel. The other one is a 3-tier worksheet. And I will be discussing that a little bit more during this presentation, but you can go there and take a look at them. I would recommend that all business owners download both and look at both. So in terms of determining the basis for indirect costs, fringe benefit is probably the easiest one to answer because many of us have received paychecks before and fringe benefits have been calculated for us. And in fact, we had a hand in determining what those fringe benefits are. So we selected a certain level of health insurance or life insurance or childcare deductions or FSA, healthcare account types of expenses. So we know what those are. When it comes to overhead and G&A, it can be a little bit trickier. So you'll notice that in this Appendix C, that overhead comes as the third cost item here. It's in the middle of the page. And it comes right after direct labor and fringe benefits. And that is because very frequently overhead will be applied to direct labor and fringe benefits. And so it is a natural progression. That doesn't mean that it always has to be done that way. Sometimes it's a function just of direct labor and fringe benefits are not included in overhead. And I was trying to figure out a situation where you might apply overhead only to fringe benefits and not direct labor. And that might happen if you have an unpaid intern position where you're paying it direct, where you're paying fringe benefits, but not direct labor. So it can vary. It really does depend on your business and how you're running it. In terms of G&A comes at the bottom there as item number 5. And you'll notice that it comes after other direct costs, which is item number 4 on the Appendix C page. And so Other direct costs includes things like travel, equipment, supplies, subcontractors, consultants, miscellaneous other direct costs. And there may be items that are included and excluded from G&A. Very often, I find that the SBIR applicants will propose a subcontractor that is a university. And if you look at the negotiated indirect cost rate agreements for universities, you will often see exclusions. So for instance, the first $25,000 of a project may be exempt from their G&A costs. And so those would be an exclusion in this case for the subcontractor, but your business may have similar exclusions. And again, examples of exactly what it depends on your business. So sorry, that's a very sometimes aggravating answer. It depends. So you would, if you fill out, if you're proposing a subcontractor, I would recommend downloading the indirect cost rate proposal for that subcontractor and looking at it and making sure that the fringe benefits and the overhead and the G&A that you're charging on your proposal match those rates. I certainly look for that. I look for matching. I want to see that those costs have been carried through accurately. In terms of the 40% rule, the IDC rule, if you look up that notice announcement, it will say in the first page that 40%, if businesses are charging 40% or less on their indirect rates, the proposal does not have to be evaluated or negotiated by DFAS. DFAS is that division of financial advisory services. What it does not mean is that you don't have to justify your indirect cost rates. You do have to justify them. And again, that is where those two worksheets are so helpful, because DFAS has given you a template to fill out in justifying your costs. There are certain costs that are not allowed on indirect cost rates. One of them are institutional research and development costs. There are others. I wouldn't worry about them getting that right too much on the first Appendix C. If there are questions about it, you'll be notified by the contracting officer. So you do have to justify it. And at any time, DFAS reserves the right to evaluate and audit those costs. So the 40% rule is not a pass go and get home free, get out of jail free card. You can't just plunk down 40% for overhead and 40% down for G&A and be done with it. You have to say why you put those down. And that brings me to, let me just review quickly the ratio of prime subcontractor costs before I go to my next slide on the indirect cost rate worksheets. The solicitations will have in their offer eligibility and performance requirements, there is a requirement for phase one proposers to have 2/3 of the research effort be performed by the prime proposer, by the small business. And then they are allowed to have consultants and subcontractors help them, but not beyond 1/3. So we look at, the way I would look at that is I will count up all of the direct costs and I will divide that number by the total direct cost, which is found at the bottom line of that Appendix C. So I will exclude subcontractors. I will sometimes exclude consultants. Sometimes I don't. It depends on the topic and the cost. And if that ratio is 66.7 or 66.67% or higher, then that has satisfied that ratio. If it is below that, I will ask the proposer to rebalance their costs so that 2/3 of the effort does go to the prime contractor or offerer. For phase two, that ratio is half. And that brings me to my next slide, please, Reema. So here you see a picture of the two worksheets. I have the URL is underneath it, so you can look it up. And they are called two-tier. The first one on the left is two-tier, and the one on the right is a three-tier. If you look at the part that I have circled, you'll find two tabs beyond the worksheet, and those are the two tiers. So if you use that worksheet to calculate your indirect rates, you'll get a fringe benefit and an indirect rate. You can call that overhead, you can call it G&A. It doesn't matter to us. The other one on the right has three tabs to the right of the worksheet tab. And for that one, you will end up with a fringe benefit rate, an overhead rate, and a G&A rate. So if you remember from my definition above, in terms of indirect rates, the difference, the DFAS difference was that for overhead, you had cost associated with one project, and the G&A was associated with an organization. So if you are a young SBIR company and you don't have more than one project, the difference between overhead and G&A essentially disappears. That is your one project. That is your organizational project. So you won't have a lot to do to differentiate those two costs. With time, you will get more projects. You will have more employees doing things that are unrelated to your direct project, and you will start to veer into this area of G&A. So if you look at the categories to the left of these worksheets, they're both the same. They start out with labor and they go on vacation and costs like that. So the way you fill these out, if you are a company and you have an income statement and a balance sheet, you will find those same categories on your income statement, and you would simply transfer those numbers. If you don't have an income statement and a balance sheet, then you will have to retrieve that information from other sources. And the other sources are, you might have a checking account that's devoted to your business. You might have a credit card that you use only for your business. Tax returns will certainly have some of those costs listed. So you may have QuickBooks. You can retrieve that information from those types of sources and start entering them into that column. This presentation isn't long enough for me to go into filling this out. I'd love to have one, but the columns to the right of that first column that says, what does it say, amount, the instructions will help you figure out what to put into those columns and what to include and exclude. And you will, if you click on the fringe tab and the indirect tab, it will provide you instructions on what to put in and what to take out in calculating your rate. So when you have completed these worksheets, either one, you will find which one is most appropriate for your company. Reema, if I can ask you to go back to the first slide that I had, you would go back to the Appendix C, and under line 3, where it says fringe benefits, you will now have a rate that you have calculated. You would enter that rate. You can enter up to probably 1 or 2 decimal points. For the bases, you will know what to include in those bases because you've gone through the worksheet to develop what goes in and what doesn't. And for G&A, which is line 5, you will also have a rate calculated, or you will say 0%. And you will also have some clue what to put in the bases, what to include and what to exclude. So those 2 worksheets will go far in helping you clarify both your cost proposal and in answering the technical and administrative cost questions that you will receive if you are selected for negotiations in this award. And that concludes the information that I have to share with my audience. Thank you, Reema.
Thank you so much, Christine. Thank you so much, Christine. That was wonderful. That was, I think that was one of the most important aspect, regarding how to how to put the budget together. With that, we will come to our final part of our webinar today, and that is going to be the question answer session. So we have, for question answers, we have Deepa Narayanan, She is a program director and team lead at NCI SBIR Development Center. We have Christine Biser, who just spoke about the Appendix C, and she's a contracting officer at NCI OA. And finally, we have Tiffany Chadwick, who is a branch chief for policy and oversight at NCI OA. So before we go into, we received a few questions already. However, before we go into actual questions, I want to ask you, Deepa, if you have any comments regarding the contracts, and then after that, I'll come to you, Tiffany.
No, I don't have any additional comments, but I'm happy to answer any questions. So if you want to type them either in the Q&A box or the chat box, we're happy to answer any questions that you have.
Sure. And Tiffany, if you have any comments, that offerers or prospective offerers should remember before submitting their proposals.
Sure. I mean, just one thing that I'll touch on is we get a lot of questions about how you move from your phase 1 contract award to the phase 2. And if we didn't cover it as in depth so far, just wanted to point out that the publicly posted solicitation is only for your initial SBIR award. So if you get a phase 1 only contract without a fast track option, and you didn't do direct to phase 2 in the PHS 2022-1 solicitation, the year following that, you will not be looking out in these publicly posted solicitations to try to move on to phase 2. We will email you an invitation to propose on phase 2, and that goes out to everybody who received a phase 1 award. So I just wanted to make that clear. And then I'll take questions. Thanks.
Thank you. So, so one question I have, and I always have this question, is a lot of our attendees and a lot of our companies are really young companies. They probably haven't applied for the NCI SBIR or any kind of SBIR award before. So for them, if they see a contract topic that aligns with their research interest, and Deepa, this question is for you. Is it better for them to apply for a contract, or is it easier for them to apply for an omnibus solicitation? So what is easier? What is more recommended?
Easy is a subjective term here, so I'm not going to go on the easy part of it, but I think what you said more important is it aligns well with what they can do. I think that's very, very key. So if the contract topic aligns well and you think you can respond to what the deliverables are stated in the contract solicitation, if that matches and you can really address that, then I'd strongly recommend applying for a contract. And I do that for a number of reasons. One is that because these are targeted contract solicitations, you're automatically in a smaller applicant pool. When you're applying to the grants, these are investigator initiated, and each review session has about 50 to 100 grants that they review. Each contract review is anywhere between 3 and 25 is the max that I've seen. So that is to the advantage of the applicant. The other thing is also that because the deliverables are stated, there is some guideline that you can follow when you're drafting your proposal. So that makes it a little bit easier than anything that you do in certain cases. Again, easy is subjective. It depends on exactly how you're looking at it.
Thank you. And we have a question similar to that, and I think this would be a question for Tiffany and to certain extent Deepa. Actually, a question for OA's office, entire office as such, is that do you have any information about the statistics, in a sense, how many proposals reach the negotiation phase, and once they reach negotiation phase, how many proposals do get funded? So do you have any kind of statistical data available for that?
So one thing I just want to jump in and say, what I answered in the chat was, once it does get into negotiations, the majority do get to an award. So I would say that you definitely need to respond comprehensively to every negotiation question, because we cannot make an award if we are if we do not feel like all of the concerns have been adequately addressed. However, usually the percentage is very high once you enter negotiations. And Deepa, I don't know if I have off the top of my head the percentage of how many get into negotiations. Do you, or do you want me?
I don't. I looked at it a couple of years before, and I found that the phase one success rate was slightly higher for contracts than it was for grants. But it is, again, these things vary so much because our contract topics change every year. The number of applications that we receive change every year for both grants and contracts. So I don't think I have the latest data, but a couple of years before I had looked at it, and I think the contract phase one success rate was higher than that, what it was for grants. Our grant phase one success rate is about 10 to 15%. I think the contract rate was at that time was about 20 to 25%, if I'm not mistaken. But again, this is a couple years back. I haven't done it for last year.
I agree. I think that's in the ballpark, but you know, to the point, some topics are much more competitive than other topics, so it really varies a lot.
Yeah.
But what I wanted to, the other thing that I want to answer is that there's no sort of set number of topics that we provide a range of topics that we think we would fund under each contracts in the solicitation, but that's not sort of the all and end all of it. If none of the proposals are up to mark, we may not fund any. And if there are many or several great proposals, then we do fund a lot more than that. And then the number of proposals that we have listed in the contract topic. So there's no restrictions here on we have to fund so many proposals.
Great. So there is one question that has come, and since we were on the topic of grants, is that the question is whatever is does whatever applies to SBIR on this slide apply to STTR as well?
So that's a good question. Contracts, SBIR contracts are SBIR only. We do not have STTRs in the contract solicitation. For grants, we do have STTR solicitations, and most of our grant solicitation have an STTR option. It's if you go to our funding page for grants, it is clear to see which ones have the STTR option. I think most of them do, if I recall correctly.
Yeah, I can while we are answering the next question.
This transition grant is a special one because you start off as an STTR and you end up as an SBIR. So that's a new one. Yeah, thank you for putting that up. So you will see which ones have an SBIR and which ones have an STTR option. So this particular one, which is a technology development for single molecular protein sequencing, does not have an STTR option. Our bridge award is an SBIR option only, but again, companies that have had previous STTRs can apply to the bridge award.
Thank you. Christine, there is one very specific question for you, and that the question is, can you please clarify consultants that can be excluded from 30/70 calculation?
I'm sorry, you broke up during the beginning of the question. Could you repeat it?
Sure. So the question is, please clarify the consultants that can be excluded from the 30/70 calculation.
Well, that falls into that bin of it depends, right? So I used the example of the the university indirect rate agreements that are negotiated with DFAS. And so they will often, one of the very common examples is they will have an exclusion of the first $25,000 of a contract proposal cost. So they will not apply their G&A rate to that first $25,000. Now in the phase one, that's maybe not so much of an issue because the costs often don't go that high, but in a phase two, it can. And so that presents an accounting challenge in that you have to exclude the G&A for the first $25,000. It has to appear on the bill so that it accrues. But then once the first $25,000 has been invoiced and has not been assessed G&A, then it does get billed and you do assess G&A. So other than that, there is no example that I could provide that's going to apply to all businesses. I would say it will be prepared to discuss something like that in negotiations, right? It could come up. It varies it's on a case-by-case basis.
All right. So Deepa and Tiffany, so the next question can go to either one of you. And the question is, can you apply for the two topics if at this initial stage, the same technology fundamentals can apply to both of them?
Yes, you can apply for multiple topics at the same time, as long as the specific aims and objectives and the work you're doing are distinctly different. The NIH regulation states that you can't have two essentially similar proposals under review at the same time. So if you have the same specific aims, whether and this also addresses whether you can apply a grant and a contract at the same time, and this is exact same rules apply. So if you have the essentially similar specific aims for the grant and contract and both are under review, you can't do that at the same time unless and until you receive your review minutes or your summary statement from one. You can't apply to the other one.
Okay. So I think, Tiffany, you answered this question in the Q&A, but I think I'm going to pose it for the benefit of the group. And that is, do we need to contact the program officer to make sure if our project fits in the topic where we want to apply?
Yeah, this is a great thing to emphasize because contracts are handled very differently from grants. So while you might be really used to reaching out to the project officer yourself in a grants environment, for any reason that you have to talk about a contract, especially before you have an award, you should be reaching out to the contracting office instead of directly to the project office. So as I said in the chat, just go to that NCI SBIR email address that's in the slide deck, and you can submit your question and make sure that you get it in by the Q&A deadline to ensure that we are going to get you a response. We try to do our best to respond if you send it after, but we can't really guarantee it. Thanks.
All right. So Deepa, the next question is, again, it's a little bit grant related question. And the question is it possible to be awarded both SBIR and STTR grant? A situation in which a small business has a partnership with a research institution as a key aspect of their commercialization strategy?
Yes, you can be awarded both an SBIR and STTR grant, but the same things as I mentioned before, they have to be distinctly different ideas or products.
I think this next question is about the eligibility, and Deepa or Tiffany. So the question is a PI from university eligible for the contract proposal?
So the SBIR rules apply for this because this is an SBIR contract. So the PI has to be greater than 50% employed by the small business. However, a university researcher can be a co-PI as long as there's somebody else who's going to be the principal investigator from the company.
Right, and I might just add on too that the solicitation does note that we can potentially offer a deviation to that, but I would just caution that we hardly ever endorse a deviation from the 50% employment of the small business, of the PI at the small business. So that's not a deviation that we are very likely to grant. So I would not rely on it.
I think the next question is for Tiffany, and the question is, can you please explain the page limit recommendation and how long the technical portion is expected to be?
Sure. So I think it's a 50-page limit for a phase 1, and I think 150 for phase 2, but you should always go and look at the solicitation to be sure and not just rely on what I say. But the way that works is it's really a hard limit. There is nothing excluded. Everything that you should have being sent to the technical evaluation peer review panel needs to be in those 50 pages. It includes all the appendices, that's part of the 50. And then you also generate your own content for a lot of it. And what I would do is go to the section of the solicitation that talks about content of the technical proposal or content of the technical element. And it will walk you through the outline of what we want to see. And I think everybody is in the best position when you follow the outline. So it will tell you to talk about your personnel and your facilities and your research objectives. So just follow it in the order it's stated. We like to be able to have the peer review panel just know what they're getting into with every proposal, and don't go beyond 50 pages, because anything over 50 pages, including table of contents, including blank pages you put in there, it will get chopped off and it will not get sent to the peer review. And I can also just say, if you put something in your business proposal, because the business proposal does not have a page limit, like you want to put in letters of support, a lot of the time people do put those in their business proposal. That's fine if we're going to use that to sort of confirm the cost of your collaborators for the business proposal. But you should know that that will not get sent to the peer review panel. So when they look at that, your proposal, and they want to verify that you've said you're going to subcontract, have a significant subcontract with, this research university, and they don't see a letter of support, that's often an area that they're going to note as a weakness. That needs to be in your technical proposal, right?
And I'd like to just say that as a CO, when I review both proposals, the technical and the business proposal, I go back to that solicitation and I check off things like page limits. I have checked off font size when it gets too small.
That is an excellent answer. So Christine, I think the next question would be for you. And the question is, if a company is a new startup to commercialize a university technology, and this company does not have past tax returns or income statements, how do the company justify budget items?
Well, this is a general question for new businesses, right? At what point do you start to act like a business and collect information? Now, if you're a virtual only business, you still need to track expenses for your tax returns. So for a company to say that they don't track expenses, that's not actually I wouldn't suggest it, because you'll need to put it on your tax returns. So at some point, you need to start behaving like a business and doing the accounting. There's numerous free software. There are templates available on the internet all over the place to track this stuff. And I would recommend for small businesses to get started early than late. And as I said in my presentation, also that DFAS worksheet is a good place to start.
Okay, perfect. Deepa, the next question is, do the offerers need preliminary data to submit phase 1 contracts?
Yes. The official answer is that SBIRs phase 1s do not need preliminary data. That's the official answer, but I've never seen one being awarded without preliminary data. So if you're not putting in preliminary data, you're just disadvantaging yourself. So please put as data that is relevant to that particular proposal.
So I think the next question would be for Christine again. So the overhead rates for universities are always greater than 40%. And if a small business has a university as a subcontract, how does the small business deal with that?
Well, I don't think it's true that indirect cost rates are always higher than 40% for universities or other businesses. It really depends on the business. It really depends.
And I would also jump in and say, if you go look at that policy, it's that there's a 40% cap if you don't have a negotiated indirect rate. So as long as you submit the negotiated indirect rate, then we will allow an indirect cost of above 40%.
And most universities have a negotiated indirect rate. It's not negotiated. So, and for that, and then we'll accept greater than 40%.
So the next question is regarding the review, and the question is there are actually two questions that are related to each other. So the first one is that the proposal submitted in October, it seems to be getting reviewed by a different panel than the grant proposals that are submitted in September. And is that the correct? Is that correct? Which is, and
True.
the second, yeah, and second question similar to that is how the proprietary information be handled in the technical proportion of the proposal and probably during the review process.
So yes, so the one major difference between grants and contracts are that most grants that we have are reviewed at CSR, which is a separate institute within NIH. All contract solicitations are reviewed within the National Cancer Institute. So we work very closely with our colleagues at the Division of Extramural Affairs to help to identify reviewers. And we try to have more business reviewers in the panel than there is for a normal grant that is submitted under the omnibus. So that's one difference. They are different panels, but it still means that it still doesn't mean that you can submit essentially the same application for both grants and contracts. And what was the other question that you had?
So the other question is, how is the proprietary information handled during the whole process?
So the same rules apply. So the reviewers who are supposed to sign, confidentiality agreements that state that they're not going to share the information that they see in the application or the proposal with anyone else. That being said, I would still caution people to not, to be careful. And if you have an IP already, look into that before you apply. That nobody does this out of malice, but people, some people chat because they find it cool or they find it interesting. Be careful about what you talk about in the grant proposal. We do our best. And there's nothing, and everybody knows that these are confidential information and it shouldn't be shared. But, just be careful what you're writing and make sure it, if you can have an IP before, then that's best.
I can say also that in terms of contract proposals, we stamp our proposals that they're handled in accordance with the federal acquisition regulation as proprietary.
That's a great information. And in the same vein, I think the next question is about the fast track proposals. So the question is, in case of fast track proposals, it is a separate phase 1 and phase 2 application which are required. Are these applications evaluated separately, or what happens is in the case if the phase 1 is reviewed favorably, but phase 2 is reviewed less favorably? I think I think in general, if you could talk a little bit about the fast track proposals, that would be great. How the whole review happens and everything.
Sure. So they are reviewed separately, and this is a very key difference again between grants and contracts, because in grants, even if you have a stellar phase 1, if your phase 2 is not as good, then the whole application cannot be funded. But for contracts, we review the phase 1 and phase 2 as two separate proposals. So it is not reviewed right one after the other sometimes. If your phase 1 is considered technically unacceptable, then we do not review the phase 2. But if your phase 1 is technically acceptable, then the phase 2 is reviewed. And there are cases where we like the phase 1, but we think that the phase 2 requires a little bit more work. So we will negotiate and fund the phase 1, and ask the offerer to come again for the phase 2. And keep in mind that this time there are a few proposals that have the direct to phase 2 option. This is a case where you're applying directly for phase 2. So when you're applying, make sure you read which proposals have a phase 1 only. Some allow phase 1 and phase 2 together. Some allow phase 2, and each one is separate. So just keep an eye out for how that is said in the contract solicitation when you apply.
Yeah, I was gonna ask you about the direct to phase two as well, and thanks for covering that. So I guess the next question is again the 40% question for Christine, and the question is, does the 40% cap on IDC for small businesses encompass university subcontractors FNA rates?
I'm sorry, can you say that question again? I'm sorry.
Sure. So the question is, does the 40% cap on IDC for small businesses encompass university subcontractors FNA rates?
It does. The 40% rate does not have an impact on the subcontractor. So the prime company's business proposal does not impact the subcontractor. Tiffany, would you agree with that?
We usually don't have to get into this question, but I'd say I would answer it as narrowly as possible and just say that universities almost always have an actually negotiated final indirect rate, and then the 40% doesn't even matter. So
Right.
as long as you have a cognizant auditing agency of the federal government who's issued you a rate agreement, then you're good.
The only exception that I can think of is where a prime offerer is proposing another small business as a subcontractor that does not have a negotiated indirect rate agreement. And that, I think, would be taken on a case-by-case basis by the CO in that particular case. They would look at that.
I would agree.
So Tiffany, the next question is probably for you and to a certain extent Deepa as well. Is that the one of the attendees is asking if they have a specific project that might or might not be responsive to the contract mechanism? How can that be answered? Like how do they know whether this is responsive to the contract or not?
I think it's a really great idea to send an email outlining the high level summary of your project to what's in the slides, NCI.SBIR.mail.nih.gov, and do it within that Q&A time frame, which I had up, but now I don't have up. Oh, September 3rd. So before September 3rd, submit an email with a short summary. And like I think I said before, please try to keep out confidential or proprietary information because we're going to post an amendment to this solicitation. So the same place that you found the solicitation document posted, in the next maybe month and a half to 2 months, we're going to go on there and post an amendment that's just going to have a list of Q&As. And it's going to help other people who might have had the same question too. So if you aren't sure, just say, I want to see if this might be within the scope of topic, XYZ. Here's what I'm looking to do. Send it to that email address. We will go talk to the program officers and come back with a response about whether we think it's likely to be within scope, likely not to be within scope, or why we couldn't tell. Thanks.
Okay. So Deepa and Tiffany, what are the general timelines from submission to funding decision to actual award?
So I would say, well, I'm just going to jump in and say right now, our most typical had been making sure that we get every award done by September of the following year. The peer review technical evaluation process is very lengthy and we have a high volume. However, we are always striving, and during the last year or two in particular, we're really striving to cut that down. So I think this year we began making some awards at the very end of July, and they'll still continue to be made through September, and hoping next year we can get more of them done in July. That's what I would say.
I just would like to add one more thing. And one of the things that we're doing now is that once peer review is over, if your proposal is not likely to get awarded, we let you know fairly early on, and which means then you can go back, contact program and see what are the other funding alternatives that are available to you. And then you also know when you're selected for negotiations because somebody will reach out to you, and then it's usually the negotiations process takes about a couple of months, but you have some contact. It's not a black box at that particular point of time.
Thank you, Deepa. That's a really good point. So I would say we try to make all notifications by May, to Deepa's point, about giving you some status update. And some people we've been able to give earlier status updates, even starting in February or March, if it really was that the proposal came back through the peer review process and it had a technically unacceptable, because that's a hard step that we aren't able to continue with. So as soon as we're able to have all the documentation in place to give you a final decision, we're trying to make those communications as soon as possible.
So before we go into other questions, we have few more questions. So there is small announcement. There are some questions that are very specifically targeted towards a specific contract topic. For example, what do you mean by low resource setting? And in this case, I would suggest if you have a specific question about a specific topic, please send an email to nciosbir@mail.nih.gov. Reference the solicitation number and the contract topic number with that question, so that it would be replied by a correct expert in that field. With that, I have few more questions and about the budget. And the next question is, does the any of this contract budget cover the patent IP licensing fees?
Licensing fees are allowed. There are unallowable costs. They are listed in the FAR. I don't remember the reference off the top of my head. Certainly, if I see that worksheet, I check that worksheet against that list. I go look up the FAR and check against it to make sure that that no inclusions. The one that I know of is institutional R&D costs. Does that answer the question? I guess we'll find out.
I think so. I think the next question is again from for either one of you is, how does the 2/3 effort requirement when some work is subcontracted to other small business? So I think what they're planning to do is subcontract a part of work to other small business, and how do they still manage to have the 2/3 work requirement, which is probably the part of, I guess, SBIR mechanism?
Yeah, it is a little challenging, and we realize that, you know, people are trying to operate more and more in a lean sort of mode. But for SBIR, there is some deviation that can allow, you know, you don't, even if you've not reached 66, if you're a little less than 66% is done by the small business, we do allow it. But still, we do expect that a majority of the work is still done at the small business. There are certain things that we are, you know, we realize that sometimes you need to do, say, for example, a talk study or certain things that can be done by CROs. And if this is not IP generating work, and if this is something that you can easily show as fee for service, where this is something that is available to multiple, you know, there's no new invention here. This is something that's available to any vendor who can go and sort of purchase this service. Then we, in a case, and again, this is on a case-by-case basis, and it will require some discussions between the PO and the contracts office. In some cases, we do allow that as company costs. But this is not a blanket waiver, and it depends on exactly what those kind of tasks are.
Yeah, I would just make sure to reiterate that unlike other small business set-aside programs, the way that the limitation on subcontracting works for just the SBIR program is that you still only are allowed to subcontract out the limitation. So the 1/3 or the half on the phase 2s, even if the subcontractor is a small business. So the status of the small business of the subcontractor is not integral to the analysis, really, when you're coming up with just whether you comply or not. Now, when we are doing some deviation requests, you know, we'll take everything into consideration. But if you're just trying to get by without any deviation requests, it doesn't matter if the subcontractor is a small business or university for that compliance regulation.
Okay. So the next question is a little bit long and much more involved. So the question is this way. The DoD typically has several stages before a complete financial proposal is submitted. This mechanism, as in any business-to-business interaction, is far more efficient with shorter turnaround time from initial contact to implementation of a deal. Given our falling behind in research to competing countries, would such a reduction of turnaround time be an extremely important point?
We recognize that it is a long process and it is not the most efficient process, and I'm putting it out there, and we're doing our best to shorten the timeline. But there are some things that are beyond our control, and at least the people sitting here, it's not possible. Another different major difference between DoD and NIH contracts is that in most DoD contracts, DoD is the final purchaser for the product. NIH is not the final purchaser for the product. So there's a lot of difference between how we approach contracts and how DoD approaches contracts. So that's a fundamental difference. But you know, not to say that it is a long process. We would love to shorten it if we can, but
Right.
that's the best we can do.
And it's important to note too that NIH does have a statutory requirement to do the peer review evaluation, primarily with evaluators who are outside of the federal government, and that does not apply to the DoD, so that gives us a longer timeline. I mean, I would at least say that we do fall within the timeline requirements that are established in the SBIR legislation. So I know it feels long, but you know, we're in compliance with what Congress did expect when they passed this legislation. But we're always trying. And if you want to submit, you know, information that you have on DoD processes, I'm always interested in seeing what other agencies are doing. So if you have some of that information because you worked with DoD, feel free to send it to that NCI SBIR, and we can always look at it and see what we could glean.
That was excellent answer. Thank you both. So another question, I think this one is for you, Deepa, is and we probably have covered this one before. Can a small business have an SBIR grant whose specific aims overlap with that of a contract? I guess
the answer is no.
Mm-hmm. And last question. Oh yeah, the last question we have is, would cloud computing costs be allowable as a part of small business work with contracts?
I think we have allowed that on before.
They need to be related to the project, obviously.
Yes.
Otherwise, they go into indirect cost rates.
I feel like I should at least address the fact that federal-wide, there is this sort of requirement that when you use cloud computing, you're supposed to be using a company that's got FedRAMP certification. So to the extent that you can, see if you can do that. Just be aware that might come up.
I think so. Those were all the questions. And oh, sorry. I guess we covered this question, and this one last question came up, and the question was, what is the funding success rate for these for the proposals here? And I guess you answered that it depends on the contract topics. Some contract topics are more successful compared to others. Also, the phase one of Deepa had found few years back that the phase ones of the contract have a better success rate compared to the phase one of grants. And although we don't have the actual data for each of the contract topic or from each year, but
Hi,
this is
Reema. Can I jump in?
Sure.
I looked it up while we were in this meeting today and put in the chat. I think we were at about 31% success for the last phase one CDC NIH solicitation.
Thank you for doing that, Tiffany.
Thank you. That is awesome. I guess these were the last questions we had, and does either of you, so Deepa, Christine, or Tiffany, do you have any last points to tell to our attendees? we could cover a couple of more points.
Two things that I wanted to say. One is that these are all NCI contracts. There are other agencies within the NIH that have contract solicitations, and the entire NIH Office of NIH Contract Solicitation webinar is going to be held. And Reema, help me out here, please. When is it?
It's on Thursday. I'm going to put a link in the chat right now.
So on Thursday, so if there are that'll feature contract topics from non-oncology kind of products. And Reema did mention this. If you're interested in the FDA topics, we have a separate webinar for that, because we will be including our FDA colleagues and who are experts on that, on the MDDT tool process, to answer any MDDT specific questions. So just make sure that you attend that webinar if you're interested in that particular topic. And please send in all your questions to NCI OA, and try to do it as soon as possible.
I just put the link for contract solicitation for the NIH, that is, non-NCI. I mean, NCI plus all other institutes of NIH. I just put the link in the chat. So there, all other ICs will also be presenting. So Tiffany and Christine, do you have any last points to cover?
There's no such thing as I would suggest that if you have any questions, just send them in. Really, I mean, some of the answers are really going to be very topic specific, and I would hate to discourage any business from applying. That I can say absolutely wholeheartedly. I have seen businesses apply for these contracts, and you just read their proposal and you just want them to succeed. So I would say throw in your hat.
And I would just add, again, please don't wait until the last minute to submit your application, because every year I tell people that we cannot accept their late proposal. The online submission system is not instantaneous. The button does not work the second that the clock hits the deadline. If your full files haven't uploaded by the time the deadline hits, it will not get submitted. There is not a lot I can do about it. So
yeah, really heartbreaking to tell people that we cannot accept your proposal because your proposal was 2 minutes late, and it gets a timestamp on it. So and there's nothing we can do. So please don't put us in that position. I just hate telling you that we can't accept your proposal.
It makes us feel really bad. And then just a little thing sometimes people do too is really make sure that you put both your proposal files in, because every year too, I reject proposals where they accidentally uploaded the business proposal twice in both spots instead of the technical. Or, the opposite. I need a technical proposal and a business proposal both submitted. And it's a little bit less crucial, but you do need to make sure you get your registrations done. I try to help out people who don't get it done. I have a little more leeway than I do with the lateness or the not submitting a proposal, but you have to give me your SBA registration. That's on SBIR.gov. I can't access it. It needs to come from you. You need to put it in your proposal. And I'm not sending anything through to the technical evaluation until I see that you're registered on SBIR.gov. And then the SAM.gov registration, I can check myself, but we cannot issue an award until you are registered for all awards. So right now, some people are in there for like funding mechanisms or for assistance mechanisms only. That won't work. You need to go in and make sure that you are registered for all awards. So these are very important, even if you think that, they're kind of bureaucratic and not as important, they can get you eliminated from competition. So thank you.
Thank you so much. Thank you so much to all the attendees and all the panelists for participating in today's webinar. Again, the slides will be shared with all the registered attendees, and I hope all of you have a great evening ahead. Thank you. Bye-bye.
Thank you.